Hello and welcome to this NutriBytes webinar on non-sugar sweeteners. Now, we are honoured this evening to have Nichola Ludlam-Raine and Paul McArdle both speaking on this topic. And I think anyone who works around dietetics or is in this field or has been in it for quite a while knows both of these individuals quite well. I know obviously Paul does quite a lot of things for the BDA, and actually Nichola has obviously been in social media for quite a while, and I think it's great that you've come today and you've given your time this evening to be able to give this webinar and able to present it to people around this topic, because I think there's obviously lots of questions around this topic, and it's a really important topic just to sort of demystify and make sure it's clarified and everything. So the speakers today are Nichola and Paul, as I mentioned. So Paul is an award-winning dietitian. He won one of the Chief AHP awards back in 2023, and he has over 22 years of experience in both NHS and private sector. For almost 20 years, Paul has specialised in diabetes and is currently chair of the British Dietetic Association Specialist Group for diabetes. He also was awarded an NIHR-funded PhD, where Paul researched the controversial topic of carbohydrate advice given to patients with type 2 diabetes, and has written several papers and published them on the topic. Paul is also the co-author of the 2018 Diabetes UK Nutrition Guidance, and his current role combines both working as a senior position within the NHS alongside his advanced clinical work and freelance work, which also includes working with mental health and rehab. So really sort of diverse experience working with lots of different patients. So thank you for coming, Paul. And we're pleased to have Nichola as well to present. And Nicola's a specialist dietitian with 14 years of experience, both in the NHS and private practice. She holds a first-class BSc in sports and exercise science and got a postgraduate diploma in dietetics and an MSc in health science. She's also published in the Journal of Human Nutrition and Dietetics, and she also has a diploma in diabetes management and certificate in personal training with a focus on pre and postnatal care. She's frequently appeared as a guest on BBC Breakfast. Nichola specializes in weight management, diabetes, bariatric surgery, and maternity obesity. She works for Ramsay Healthcare, a leading private hospital provider. Online, she is a prominent nutrition and health influencer with over 100,000 followers, as an award-winning food blogger at Nick's Nutrition on Instagram, or mummy blogger at Mummy Nutrition. She promotes a balanced approach to eating, and Nichola subscribes to the 80-20 rule, advocating for a diet that is healthy 80% of the time and indulgent 20% of the time. So thank you so much for coming today. And Today, the webinar will take around an hour, and we'll have Paul talk first, a little bit of background to the topic, and then Nichola will expand on the topic. So without further ado, I'll hand over to Paul, and he will share both his screen.
Okay, just checking you can see that. Great, thank you. So first of all, thank you very much for inviting me. It's a pleasure to be here. So today I'm going to be covering, as we said, the sort of a bit of background really. So something around context and definitions. I'm of course going to be talking about safety and some of the recent guidance that have come out, and then we'll look at some other evidence around cardio-metabolic risk factors, which I think you'll find interesting. So straight into it. So you'll be pleased to know I'm not really going to be talking about chemistry and biochemistry of sweeteners, but it's worth noting a bit of terminology. So you'll see terms like non-nutritive sweetener and low and no calorie sweeteners, which are kind of interchangeable. We're just going to be abbreviating that to sweeteners, just for ease, really. You may or may not know that quite a number of sweeteners are approved for use, and there are a few common ones which you will recognize the name of, so aspartame, sucralose, saccharin, etc. And some of them have been around for hundreds of years. In fact, saccharin was first around in 1879. But it didn't really gain widespread commercial use until around the First World War, when in fact it was because of sugar shortages. So So that's a bit of history around saccharin. There are regulations around their use in food and drinks, and they can't just be used willy-nilly in anything. So they're not supposed to be used in foods for infants or children. So not really any specific foods for those groups below the age of 3. But they can be in, for example, desserts, non-alcoholic drinks, sauces, snacks, confectionery, etc. So that's the sort of places you'll find them. That's obvious places like sugar-free chewing gum and toothpaste is where you'll see these foods. So how they work, in fact, is that they are hundreds, many hundreds, if not thousands of times sweeter than sugar. And that's really important because it means that they're used in tiny, tiny amounts in foods and drinks. And so we're talking milligrams of these products in drinks, really, because they're so intensely sweet. So the ADI is important, and I'm going to talk about that next. So the ADI stands for the acceptable daily intake. So acceptable daily intake, it's what it says on the tin. It's effectively a safe upper limit for lifetime exposure. So there's a huge margin of error here. How it's been set is that it's 100 times above the level which is thought to cause harm. So if you were to consume sweeteners at the safe upper limit, you're 100 times less than the amount which might cause harm if you were to do that every day of your life for the rest of your life. And there is a different ADI for each type of sweetener, which they're all based on amount per kilogram of body weight. So it depends on your size, basically. So I've got a little example here. If we take aspartame, one of the most well-known ones, and a 75 kilogram person, the ADI would be about 3,000 milligrams a day. And if we look at the average diet drink or non-sugar drink, you're looking at around 14 cans a day for a 75 kilo person. Now, I don't know about you, but in my career as a dietitian, I've never come across anybody who consumes that much. I've come across people getting close to it, but never quite that much. So we can be quite confident, and the data supports this as well, that people don't consume anywhere near the ADI. And I think it's also important to note that despite the recent World Health Organization report, there hasn't actually been any change to the ADIs, which is reassuring because it means that they're still safe to use. Okay, so moving quickly on then. So let's take a look at what some of the studies say. And I think it's worth, before we look at some research papers, it's worth reminding ourselves of the types of headlines we see in the press around sweeteners. Now, we all know what types of newspaper headlines sell papers, and they're not always entirely balanced. Hopefully, when you read the articles, you'll see a more balanced view, but the headlines can be a bit inflammatory, and it's worth just remembering that. And that's often what our patients and clients take away from the articles. So there was a World Health Organization report published this year. It was based on a systematic review which came out last year, and I think the important thing about the report is that it's based around population health advice. So it's not really aimed for us to be guided as clinicians on individual patients, if you like, because each individual patient has their own circumstances which we as clinicians can interpret. So that's really important. So it's based on population health approaches. And the key thing about it is that the recommendations in this guideline are based on evidence of a low certainty. So I'm just going to share with you what the actual recommendation is. So they suggest that non-sugar sweetener should not be used as a means of achieving weight control or reducing the risk of non-communicable diseases. Now, by that, they mean things like, cardiovascular disease and diabetes and things like that. So what's important there is that this recommendation is conditional. So based on how evidence is graded, what that means is that the evidence around the risks and benefits is not very certain. So in other words, they're saying there's some evidence for benefit, there's some evidence for risk, but the evidence is either got gaps in it, or the effect sizes are very small, or the estimates are somewhat imprecise. And so that's is kind of saying, the benefits or the costs don't quite balance up, and therefore they're making it a conditional recommendation. So they've taken quite a conservative approach, and you'll see when we look at the systematic review it's based on in a few moments, that there's a imbalance really between the observational studies and the randomized trials. So we'll have a look at that in a moment. There is a huge risk within this type of research of reverse causation. Now, if you've never heard of reverse causation, it basically means that you're looking at the order of events in the wrong order. So if we're saying that observational research suggests that people who drink non-sugar sweeteners are more likely to develop diabetes, to be overweight, etc., or to be living with obesity, actually, maybe they had that risk of diabetes or they were living with obesity, and that led them to choose non-sugar sweeteners to help. Now, that's reverse causation. Because of the nature of observational research, we don't know what order things came in, and we've got to take that carefully. And importantly, they don't actually include people living with diabetes in this recommendation. So for people living with diabetes, that's it's a clinical decision around whether or not we recommend these sweeteners. So just to cover the we can't cover sweeteners without covering the International Agency for Research on Cancer and their classification, because this has been in the news quite recently. So for those of you that don't know, the IARC classify substances from group 1 to group 3. So in other words, group 1 is carcinogenic to humans, and group 3 is not classifiable. So in other words, there's no evidence. So it's quite interesting when you look at this, because aspartame, for example, which is what was in the news recently, has been classified as possibly carcinogenic. Now, possibly carcinogenic, that basically means that there's quite a limited evidence in humans and less than sufficient evidence in animal studies. And so it's I'll talk in a moment about the other substances in the same category, but understanding the difference between a hazard and a risk is important, because what the IARC uses is they use the term hazard. So all they're doing is identifying a substance which has the potential to cause harm. What they're not doing is quantifying that, and that's what risk would be. So risk would be quantifying that. So how much exposure, how likely is it? They don't do any of that in this classification. So it can be easily misinterpreted. And I think here's where it gets quite interesting. If we put aspartame in the same category as coconut oil, pickled vegetables, and talcum powder, then it kind of puts things into context. And really, there's very, very limited evidence that supports aspartame being carcinogenic. In fact, it's much more likely, that other substances are much more likely to be carcinogenic, such as eating red meat and working night shifts. So that just helps you to put that into context. So this is the systematic review on which the World Health Organization based their guidelines. So you can look at the systematic review as a separate document, but this is a kind of high-level summary of the findings. And I think what's useful here is if you look on the left-hand side, those are the outcomes for all of the randomized control trials, which we know in the hierarchy of evidence, sit a bit higher up that pyramid. And on the right-hand side, we've got all the observational research. And you can see the little green and red arrows, and then the little circle with the cross through, which is grayed out. They give you an indication of the outcomes. So and the text in bracket is the level of certainty. So we've got low, very low, moderate, and that relates to the grade system. So a little green arrow going down suggests that there is a decreased effect, and that's significant. A red arrow going up suggests increased effect that is significant. And what you're seeing here, it's quite striking when you look at it, is all of the potentially negative outcomes sit within the observational research area, and pretty much all of the positive benefits sit within the RCT area. And that speaks to me about this issue of residual confounding, where, are we correctly measuring everything? And the issue of reverse causation, where, we don't necessarily know which order things come in. And that helps to explain some of the perhaps counterintuitive results that we see in the observational research. And the guideline that you have published really puts a lot of weight in the observational research, which I think is why they've come out with this recommendation not to recommend sweeteners at a population level. But you can see on the left-hand side, there is evidence for sweeteners reducing body weight, BMI, energy intake, and sugar intake. And you can see the little box where it says mostly in NSS arrow sugars. What that means is where we're replacing sugars directly with sweeteners. Yeah, so this is about taking, for example, sugar sweetened beverages, SSBs as we like to call them, and replacing them with non-sugar sweetened beverages. And that's where we're really getting the main effect and the main benefit. So I'll move on in the interests of time. So let's look at some of the other more recent research. So these studies were not included in the systematic review or in the WHO guideline. They've come out more recently. And they're really interesting studies. So I'm going to show you a couple of studies which kind of take what WHO have presented and look at it in a slightly different way. This one by Lee et al. Looked at 14 cohorts. And so you're looking at over 400,000 participants within these cohorts. And what it's done is it's looked at observational studies, and it's, rather than looking at all observational studies, it's looking at those where there was a kind of swap or a change. So in other words, if you look at observational studies, you're just looking at exposure. So if you take a whole group of people and say, okay, what was their exposure to this thing? And here we're talking about sweeteners. You sort of, you're at huge risk of that reverse causality. You don't know what came first. What Lee and colleagues did was they looked at where it was a change or an intentional substitution. And so that makes a huge difference to what you find in the outcomes. So they looked at 3 types of substitution. So one is where you change sweeteners for the sugar sweetened beverages, which was what we talked about earlier. One is where you change water for sugar sweetened beverages, and one is where you change sweeteners for water. And effectively, the one where you change sweeteners for water is kind of the control, and that's the one where you don't want to see any effect, because that would suggest that the sweeteners aren't really doing anything. Okay, so this is the results. So what we're seeing here is, and sort of the headline result here is that an increased sweetener intake is associated with a reduction in weight with no adverse outcome in terms of type 2 diabetes risk. So I'll just explain that to you. So you can see at the top here, so where we're substituting sweeteners for sugar sweetened beverages, what you're seeing here on this plot, now if you're not used to interpreting these plots, if the line crosses the center line, so if the horizontal line crosses the vertical line, we're saying there's no effect. The size of the bubble represents the kind of precision. So the biggest bubbles are, or the biggest dots are the least precise, so the smallest ones are the most precise. So you can see, for example, here, obesity incidence definitely on favouring the side of switching sugar for switching to sugar non-sugar sweetened beverages. And what's really interesting here is this type 2 diabetes incidence. It's crossing the line, and therefore it's showing that there isn't a negative impact. And that's quite reassuring, because you look at some of the observational studies which don't take this approach, and they show there is a negative impact, which this now has kind of corrected, really. So we know that if you intentionally substitute sweeteners for sugar sweetened beverages, you get it's associated with a reduction in weight and a reduction in the risk of obesity, coronary heart disease, and cardiovascular disease mortality. So that's a really useful paper. So here's another one by McGlynn and colleagues, and they actually took a very similar approach to the Lee team, except in this one, they looked at 17 randomized control trials. So it's a slightly smaller population of about 1,700, but same approach, but rather than observational studies, they're looking at randomized control trials. And they did what's called a network meta-analysis. So normally in a meta-analysis, you're comparing one thing with another. And what they're doing in this was they were putting the three different comparisons together, the same three comparisons that we were just talking about, actually. So where you compare the different substitutions and changes. And here's the results for this one. So again, when you look at substituting sweeteners with sugar-sweetened beverage or sugars, you see a positive outcome. You can look at the top of this chart here, these ones on the left, which are not touching or crossing the line, see a positive outcome associated with reduced body weight, reduced BMI, and reduced body fat. So, and what you also see is neutral outcomes when compared to water. So effectively, this study is saying that you get some positive outcomes when you switch the sugars for sweeteners, and in fact, if you look at the comparison with water, the sweeteners have a very similar effect to water, which is great. So these two important studies are telling us that whilst we've had some doubt cast over the benefit and the place of sweeteners over the recent years, and some of the papers have come out, replacing sugar-containing drinks with sweeteners does have benefits, certainly over the medium term. So that gives us some reassurance for that. So I couldn't talk about sweeteners without mentioning this study. So you've probably seen a few studies come out from this group, so DeBrass and colleagues, and they've actually published from the Nutrinet Santé cohort several different papers around sweeteners. They're kind of slicing and dicing the data so they can get more papers around different topics. So there's one here on cardiovascular disease, and I've chosen that one because it's related to the two we were just talking about, but they've also got one out on cancer risk and diabetes risk. And they all show, as observational data, an increase in risk of all of those things in relation to sweeteners. Now, what's important to know about these papers is they're observational. So remember, we've got those concerns or issues around that methodology. It's a French cohort of over 100,000 people over a period of 9 years. Now, it's 80% female, and these people were self-selected. So they were asked to take part in this kind of online study. So they're self-selected, and as such, we found they have a higher level of education. What's interesting in the data is how they treat the dietary data is quite interesting. But one thing that you'll note if you look at it is that where they found the highest consumers of sweeteners also consume more sugary drinks in the group. So one of the things we have to consider with this particular study is the effect of residual confounding. So there's things that possibly weren't measured or can't be accounted for in the analysis, and a huge risk of reverse causation in this particular study. So these middle-aged women, were they more likely to have a higher BMI in the first place, which therefore led them to select more sweeteners? Who knows? Well, we don't know that answer, but it's a risk we have to consider in this type of research. So bringing us to a close then. So just to conclude, I think it's worth making the point very clear that sweeteners are safe for use within the ADI, and pretty much nobody gets anywhere close to the ADI. There is limited evidence for a long-term health concern. So the evidence that does exist is mostly observational, and the certainty of that evidence is low. There is some short-term evidence for reductions in sugar intake, in energy intake, and in body weight and BMI, particularly where the sweeteners are being used to replace sugars, and particularly in people with a higher BMI. So they do offer a choice to people who are seeking that sweet taste without and wanting to reduce their sugar intake without just only wanting to drink water. And therefore, as health professionals in the nutrition space, our advice should be based on the individual needs and circumstances. And of course, we always need to take a whole diet approach. So that is the end of my presentation. There's some references there which you can have a look at later as well. Thank you.
Thank you so much. That was a brilliant presentation, and I think I love the way you talked about sort of how a different research applied in different contexts, and you really illustrate the difference between observational and some of those more controlled trials that actually indicate swapping, and that's often where it's used in clinical practice quite often as dietitians. So it's a really relevant point you make around sort of swapping, and when we see a patient, gives us confidence in recommendations where we feel based on our clinical judgment that would be appropriate. Thank you so much. We're going to have some more questions later for you, so yeah, hang tight, and I'll hand over to Nichola, and she will talk more about this topic and go a little bit more into detail.
So hi everybody, and thank you so much, Paul. I found that talk really insightful, and I was there taking screen grabs. So every day's a school day when you're a dietitian. So I found that really interesting. Like, thank you so much, Paul, for breaking down the evidence. From my point of view then, I still work clinically as a dietitian, although I am present on social media. So I work in the area of bariatrics. In January, for February, March time, I left the NHS after 14 years, and now I just work privately for Ramsay Healthcare and then online with brands. So I quite like the divide because I'm still working clinically in obesity, but also I've got the wellness side as well. So I hear the fear-mongering and the scaremongering that goes on. And then thirdly, I'm also a human being, and I've got a family, 2 young children, and like when I was doing these slides, I think one of the questions was around children, and it made me think, before being a mum, I would have said no sweeteners for my children. However, they're aged 1 and 5, well, 1 and 5, nearly 2 and 5, and they drink fruit shoot on an almost weekly basis. I personally also drink no added sugar squash, love a Diet Coke and a slimline tonic. And that's why I chose to work with the British Soft Drinks Association this year, because from a professional point of view, I talk about sweeteners and recommend people swap to the diet versions of drinks. And also personally, it exists in my life because I want nice teeth and I want to manage my sugar intake and still enjoy nice tasting things. So I always say to my friends that I prefer to get my sugar from food like chocolate and then have like a diet drink on the side. So that's just like a little introduction as to why I chose to work with the British Soft Drinks Association. So we're going to talk a little bit about non-sugar sweeteners in practice, a bit about the benefits of using them in replace of sugar, so from an oral health point of view, weight management, and then looking at longer term health risks as well, and finally finishing on using non-sugar sweeteners within a healthy balanced diet. Because I think that's the key, isn't it? It's about the balance and looking at the bigger picture and moderation, not deprivation. So exactly like Paul said, it's about the dose. So I've already been introduced, and the reason for this part, it's about the clinical application and a use day to day, just because we thought it'd be quite interesting. Because often, especially when you're working freelance, you don't know what other dietitians are or are not recommending. So from my point of view, so I work with people who are undergoing weight loss surgery, predominantly gastric bypass, gastric sleeve, sometimes gastric balloon, gastric band. And when they're having a gastric bypass and a gastric sleeve, they have to undergo a liver shrinkage diet. So your liver, obviously, is a huge organ in front of your stomach. It holds glycogen and water. So we have to put them on a really low carb diet in order to shrink the liver so that the surgeon can go in keyhole, move the liver to one side and get to the stomach. That can be really hard. It'd be hard for the majority of us watching, never mind someone who might be having a rather high carb, high sugar diet in the first place. a lot of my patients do report drinking copious amounts of fizzy drinks, whether that be Diet Coke or like full sugar Coke. And no one is disputing the fact, as Paul mentioned, that water is obviously the best choice for everyone, for teeth, for weight, for health. However, when you're going down the pub on a Friday night, ordering a pint of water or a glass of water, doesn't really cut it. It doesn't cut it for me. So why would it cut it for my patients? So that's where swapping to the diet versions of drinks, trying to get them to wean down, because after surgery, people can't have fizzy drinks. But also you can get like the still flavored waters, which use non-sugar sweeteners. And I still think that there is a bit of a myth amongst my patients in that they don't understand the difference between diet and full sugar. And some people still think that the diet alternatives contain sugar or are fattening. And I still get emails every single day saying, "Oh, Nichola, can I have a sweetener in my tea, both before and after surgery?" And I always reply saying, "Yeah, like it's totally fine. It's totally fine." So low sugar diets after surgery are also recommended because of the risk of dumping syndrome. So basically where sugar, it dumps into the intestine. So that's another scenario where 100%, if people are trying to still enjoy their sweet foods, where sweeteners may come in, and I'll explain in a moment how I would use them day to day. And also, like, weight loss surgery aside, from a weight management point of view, it's just really good to be able to help people to control their calorie intake whilst not missing out on sweet foods. Like, for example, myself, I love a morning coffee and I have a sweetener in it because I don't like the taste of coffee, but coffee in itself has health benefits as well as perking me up in the morning. So I've made that decision to include a non-sugar sweetener within it because I understand the risks and I understand that I'm not having 14 cans of sugar sweetened pop every single day for the rest of my life. So what are the benefits of using non-sugar sweeteners like instead of sugar? So first of all, from a weight management point of view, they help you to enjoy that sweet taste with less or no calories, depending on what you're choosing. From a point of view of our teeth, so there's going to be less dental erosion because non-sugar sweeteners do not cause dental caries or cavities, whereas cane sugar, honey, maple syrup, date syrup, all your natural sugars, sugar is sugar, can cause issues with your teeth. From a gut health point of view, we know that the studies out there are mainly on rodents, and they're where rodents have been given such high doses of sweetener that is not really replicated in the human population. So small amounts of sweetener haven't been shown to alter our gut health. Having said that, though, in some people who are sensitive, they might, for example, like erythritol, sorbitol, the sugar alcohols, they can sometimes cause a little bit of bloating. It's not harmful. If someone's sensitive, I just advise them to swap to a slightly different one. And type 2 diabetes. So before I left the NHS, that was my role as a diabetes dietitian. So diabetes and obesity. And I regularly recommended patients, for example, if they wanted a sweet tea or a sweet coffee, use sweetener instead of sugar to help manage their blood glucose and their blood sugar levels, because it would mean that the blood sugar levels wouldn't be raised and they wouldn't require extra insulin or extra medication, and it would help to lower their HbA1c. So let me slide across. So non-sugar sweeteners as part of a healthy, balanced diet. So we already know that sugar is found in many foods. So your cakes, sweets, biscuits, also sugar-sweetened cereals. They're known as empty calories because they don't provide any nutrients. They just provide sugar and energy. And per teaspoon, so you're looking around 20 calories, which doesn't sound a lot, but when you're in clinic and you're doing a diet history and then someone's having 5 cups of tea with 2 sugars in it, 200 calories a day, 20-pound weight gain a year, which is 1.5 stone, it can really add up. And that's one of the things that I love doing in clinic. It's just kind of like adding up how much of a difference they could make with a simple swap. Because we know in clinic, it's not about giving people a whole list of things to change. It's about making a small change that's going to make a big difference when done consistently over time. And also by swapping to a sweetener, it doesn't require a lifestyle change. It just requires a slightly different purchase in the supermarket. And I often say that, if you're going to a coffee shop or a cafe, just to use the sweetener there to see if you like it, so to try before you buy. And often some people might be a little bit health conscious and are wary about what they've read in the media. And I give them like one of two options. I can say, well, firstly, you could try the more natural sweeteners, for example, stevia or xylitol, or why not have one type at home and one type at work, and then, like sucralose, xylitol, stevia, and just mix it up. And then your chances of ever reaching that ADI, well, in the first place, you wouldn't get there, but it's even lower. So that's something practically that I talk about in clinic. So sugar is a relatively inexpensive ingredient and it tastes good, as we know. It's fine to consume sugar, but the key is moderation. So the guidelines around 25 to 30 grams of free sugars a day, which if you've ever looked at labels, is really easy to achieve, especially if you are drinking sugar sweetened pop. Think like it's a can of Coke, takes you over the recommended daily allowance for sugar. Foods containing sugar are often combined with fat, for example, sugar and fat. Ice cream, those foods are really moreish and are really easy to overconsume. So that brings us on to the fact that non-sugar sweeteners are a great and easy substitute. So you can still get that sweetness without the extra calories and the extra sugar, which would contribute to your free sugar intake. So going back to clinic, so hot drinks such as tea and coffee, you can easily use sweeteners instead of sugar in there. Also, like your sugar-free syrups are a good one. And soft drinks, like I said before, no one is saying that soft drinks are better than water. But you've got to live in the real world when you're giving advice and just think, what would you order if you're going out to a restaurant, for example? They're fine in moderation, and the non-sugar versions, the diet versions, do provide that sweet taste and the social aspect without the added sugar and calories. So from a practical point of view, I would recommend all registered nutritionist dietitians have a go at baking with sweetener, just because then you know what you're advising in clinic. Xylitol is one of my favorites because you can use it like weight for weight and volume for volume. So when a cupcake recipe says use a cup of sugar or use 75 grams of sugar, you can use it like for like. And xylitol is actually really kind to your teeth health. And I think it contains about half the number of calories, and it doesn't contribute to your free sugar intake. I've just said that, try different sweeteners, because one non-sugar sweetener might work well in jam, for example, like stevia or sucralose, but it might not work in muffins, because you have to understand, like in baking, sugar doesn't just provide sweetness, it provides structure and moisture. So you have to use an appropriate sweetener. So Google, I'm sure there's lots of influencers on Instagram, chefs and things who would be able to advise you on different types, and then you can pass that information on in clinic. And just be careful with things like maple syrup and honey. When people, I think it's like that health halo, when you see a recipe online and you think, oh, it sounds really healthy, but actually maple syrup and honey are still free sugars. And actually, when you're using, for example, honey in like you put it in tea, I used to work in Bradford, so the South Asian community. I think there was often a belief that honey is better than sugar, but actually if you put a teaspoon of honey, some research shows that you actually put in more than a teaspoon of sugar, because the way it's displaced and the fact that it's a liquid. So in summary, non-sugar sweeteners are found in lots of everyday products like your toothpaste, cough syrup, yogurts, ketchup, baked beans and chewing gum, which is a big one. Also, no added sugar sweets. Non-sugar sweeteners can be a useful option, especially in the areas that I work in, so bariatrics, weight management, and diabetes. And the whole diet should be looked at before giving individualized advice. So I always say it's about what you should be eating more of rather than like depriving yourself, but equally it's about making healthier swaps. And I just wanted to highlight this BDA statement policy, which you can look up afterwards. But they basically are supportive of us using it within clinic. And I just think it's a really nice summary there. And that concludes the end of my talk. So thank you so much for listening, and I'll pass you back to Aaron.
Thank you so much. That was some really good practical advice on how it can be used with people in their everyday life and the impact it has on many different aspects of our health and conditions that patients might have, or we might actually have ourselves. So that's really, really, really useful. And I think I can obviously liken to a lot of the things you said in that presentation around sort of maybe some of the health halos around certain things, and also the ways to use them with patients and actually be aware of what we're advising. And I think that sort of practicing baking with different sweeteners is a really useful thing, particularly if we're recommending them, because I think dietitian skills is really is converting that scientific evidence into practical advice. So we need to actually do that practical advice. We can't just, however much we like research and reading it, but it's not just about what's written in the research or what we can understand. It's actually about that practical advice and how to input it into our everyday lives. So thank you so much for your presentations. I just want to say again, now people have sent in some questions around the topics you've discussed. So we've got a few questions that we could make through one by one. So feel free to answer them. I think the first ones are for Nichola, if that's okay. So the first question is, what is the effect of sweeteners on the microbiome?
Yeah, so a handful of recent studies have suggested that sweeteners, they may alter the gut microbiota, so your gut bugs. However, research is ongoing. Most of it, like I said before, is in rodents, and the amount that we're given is quite substantial. Kind of like it's not replicated in what we would do as humans. As Paul has said, and as like WHO have said, non-sugar sweeteners are safe, and the verdict of the European Food Safety Authority it is the same, that they're safe. And I just think you need to work on an individual basis. So like I said, some people can't tolerate certain ones. Like I'll always remember the day that I ate a packet of sugar-free Polo mints in one afternoon, and oh my gosh, horrendous. So yeah, it's all about dose and how much. And a lot of my patients, they do buy sugar-free sweets and they just have one or two. And if you can do that, that's fine. But yeah, eating a pack of sugar-free sweets is not recommended because of the sugar alcohol. So yeah, I think it's more about, when it comes to your gut, it's about what you add to your diet. So focusing on your 30 plant-based foods. And so that's why I can say, I don't think sweeteners affect my gut, because I'm doing all of these positive things, whereas a patient might not be doing these positive things. So focusing on what you're adding in, and then a little bit of no sugar sweetener is not going to really make a big difference.
Yeah, that's a really good point. Focus on, because I think with diet, people are so eager to take things away or ban things or say things aren't allowed, but actually focusing on what to add in is obviously, I think, a little bit more of a healthy way to approach it. And hopefully, as we add in those vegetables and more of a plant-based diet, then it can sort of displace some of those other foods, and we're obviously full. So next question is, this one's for Paul. What is the evidence behind non-sugar sweeteners being a cancer risk?
Yeah, so, and this is the one that the newspapers love to put on their headlines, isn't it? And I said in the presentation about the observational research by DeBrass, which they even highlight themselves actually in their paper, but they highlight the risk of reverse causation. So we have to be very careful with some of the observational research, but there hasn't been any causal link found between sweeteners and cancer in humans. What a lot of the sort of scary newspaper headlines are referring to is research done in the early 2000s in rats, and a bit like Nichola was saying about the gut microbiota, they gave rats massive doses of sweeteners, far more than anybody would ever consume, and they found a link with some types of cancer. Now, the methodology and the sort of procedures of those studies were questioned, and later those findings weren't found to be particularly valid, but also the potential mechanism, the biology in rats for how those cancers developed is known to be different to humans, so it doesn't apply to humans anyway. So there isn't a good evidence base there. The only evidence really comes from the observational studies where we've got those risks around reverse causation and confounders.
Thank you. A next question that's come in is for Nichola. Which is better, sugar or sugar-free drinks if calories are the same?
Yeah, so this question it took me a while to get my head around, but I mean, ultimately drinking too many sugar sweetened beverages is going to contribute to excessive calorie intakes, doesn't really fill us up, and also tooth decay. So I think it's about choosing what aligns with your health goals at that time. For example, I've said before that I personally choose to drink diet fizzy drinks when I'm out in the evening, but I might order a chocolate cake. And if I'm going to drink water, I do add a sugar squash just because I don't like the taste of tap water. So yeah, that's not to say that I might never have a sugary drink, but it's about the moderation and the point in time. But ultimately, I advise my patients to switch to the sugar-free options because I'm about weight control.
Yeah, and I think also the question was probably quite hard because actually how many drinks have the same amount of energy and they're sugar-free as well? It's probably not a very real world question, but I think the purpose of the question was to ask, sort of get rid of that sort of confounding variable and really question you on the difference between the two. So the next question is for Paul, and it's, do non-sugar sweeteners trigger insulin secretion?
The research doesn't support this. I mean, there have been some small scale studies that show insulin responses in relation to sucralose, but actually there are systematic reviews done on this, and the most recent one was published this year by Zhang, and a bit like the studies I presented earlier, which found that the effect of non-sugar sweeteners is comparable to water. So no, there is not a sort of a postprandial response to insulin or glucose or anything from non-sugar sweeteners.
Nichola, as a popular, obviously you're here as Nick's Nutrition, but you also run you're a mummy blogger on mummy nutrition as well, so it's definitely an interest of yours. Do you have what would you recommend for children under 5?
Like I was saying before, so I mean the guidance for under 5-year-olds is to avoid non-sugar sweeteners, but also I suppose sugar sweetened drinks as well, because at this age you're establishing the healthy eating habits, so of course the focus should be on like natural nutrient dense foods that support your growth and development, like fruits, vegetables, proteins, carbohydrates, healthy fats. However, in the real world, and thanks to glorious marketing, my children do have the fruit shoots. I think it's harder for the second child. For example, so my first child didn't have chocolate until he was about 2, wouldn't have known what a fruit shoot was until he was like 2 or 3, whereas the second child sees the first child drinking it and then wants it. If you have ever tasted fruit shoot, it is off the scale of sweetness, and I would still love to write to them to say you do not need that sweetener in there. Like, it's got natural fruit juice, it's got water in there, it doesn't need to be that artificially sweet. I can't drink it personally, I think it's disgusting, but my kids love it, and it's just really unfortunate that whenever we go to a pub, a beer garden. There's nothing else that my kids can drink. The fruit shoot is at eye level. So of course, in a perfect diet, don't have fruit shoots for under fives. And they're not allowed it in school and things. It's water only. But in a real world, like once a week, I don't see the problem. I think there's probably greater issues, like a recent report that I read that kids are having like 2 portions of fruit and veg a day. So I think that's a bigger concern than people having fruit shoots like once a week. So there isn't any safety risk from my point of view. It's just from establishing healthy eating patterns, and you don't really want those kids craving sweet foods. Obviously they're not addicted, because food's not addictive like nicotine and things, but yeah, you just don't want them to develop a taste for it.
Perfect. And it is really hard just due to environments, and you still got to live your life at the end of the day. And obviously so on the topic of monitoring our blood glucose and insulin secretion and things like that, someone's done a slightly sort of left field topic, but I think Paul should be able to handle it, I'm pretty sure. So just someone's asked a question about what is the evidence behind non-diabetics using things like CGM devices, and I assume they mean some of those devices that sort of patches on your arm that sort of measure blood glucose levels over sort of a continuous monitor.
Yeah, the continuous glucose monitoring trend. Yeah, it's become a big thing, hasn't it? In a word, there isn't any evidence. Actually, yeah, people who are signing up to these continuous glucose monitors are often doing it as part of a commercial trial, and they're paying quite handsomely for it as well, I might say. And hopefully they're contributing to some sort of evidence or research base, but we know in people who have normal glucose metabolism, there are fluctuations in blood glucose which are normal. And so therefore, there isn't an evidence base for people learning the response of different foods and drinks if they don't have a problem with glucose metabolism. So in other words, if they don't have diabetes or pre-diabetes, then it does risk creating anxiety for people. And actually, you don't need to wear a continuous glucose monitor to know what a healthy diet is. So yeah.
Thank you so much. And actually, they're quite expensive. I'm sure you could spend your money on other things that would actually help you live a healthier lifestyle as well. So actually, might be worth redirecting some of that effort, just how Nichola talked about redirecting the effort to increasing children's fruit and veg intake, redirect some of those finances to make following a healthy lifestyle a little bit easier. So just one more question for both of you, if that's okay. So we've also got a question here around, do non-sugar sweeteners increase appetite after consumption? That's for Nichola, sorry.
Yeah, no, thank you. So I think research is mixed. However, the ultimate evidence says that these non-sugar sweeteners can help with weight control. So I think it goes back to what I said about like bloating in the gut. It's an individualized response. So if somebody has a non-sugar sweetened drink and then they are craving sweet foods, then obviously you're going to try and get them to reduce it. Like with other patients and with myself, if I have a sweetened drink, it doesn't increase my cravings. So it's at an individual level, and that's what we do as dietitians, isn't it? We don't give out blanket advice. We listen to the patient, do a food and symptom diary, and so forth. So yeah, it's on an individual level, but ultimately, the evidence supports it from a weight management and a diabetes control as well.
Yeah, thank you. Now there's one last one for Paul from a student dietitian. Well, actually, no, they might not be a student dietitian anymore, but they're referring to a time when they were a student dietitian. So when I was a dietitian in training, I was told not to suggest diabetic versions of products and give people real food. What if that is wrong, why is having diet drinks okay?
Yeah, that's a good one. I like that question. So many moons ago, when I was also a student dietitian, there was some of the supermarkets and even large chemist chains, which I won't name, had these foods labeled for people with diabetes. They called them diabetic foods, which just It gets the hairs on the back of my neck up. But they were very expensive. For starters, the types of sweeteners they contained, Nichola referred to earlier, the sugar alcohols or polyols, they can have an effect on the gut if you consume them in, you know, more than the recommended doses. So that wasn't necessarily an advantage. And actually, most people with diabetes have type 2 diabetes, and most people with type 2 diabetes, weight is a concern for them. And a lot of these foods labeled diabetic weren't lower in calories than the standard versions. They were also higher in fat. And so they weren't necessarily a better option for people. So that's why they weren't recommended. Now, the sweeteners used in soft drinks are very different. We don't use sugar alcohols or polyols in soft drinks. It's a very different type of sweetener. And so you don't get those kind of gastro effects that you would have got with those. And actually, in people with diabetes, you know, if we look at type 1 diabetes, if you have type 1 diabetes, you would never be able to drink a full sugar soft drink unless you're treating a hypo. So, you know, they really open up the choices for people.
Yeah, it's a really good point, actually, particularly in the patients with type 1 diabetes. Actually, it almost gives them accessibility to try some of these things that non-diabetics get to sort of have with impunity, as their insulin secretes automatically, should we say. But thank you so much for answering the questions and the brilliant presentation on this topic. I know it's quite topical, particularly this year. So thank you so much for explaining everything so well and going through the questions people have asked. And I would implore everyone to find you both on social media. I know Nichola is quite active on Instagram on both pages. I suggest you follow both because I think they're really informative for different groups of individuals. And being both a parent and a dietitian myself, I find both of them quite interesting just to have a nosy at what's happening. And obviously, I also know Nichola, so it's nice to sort of see what's happening and see what she's doing. Being a bit nosy, to be honest. So, but Paul's also on Twitter. Is there any other place best to find you, Paul?
I'm on Instagram
or...
as well. I'm not like active like Nichola is, and you won't get to know a lot about my life. but I'm there. So Twitter and Instagram, you'll find me at P McArdle RD.
Brilliant. So ask everyone to sort of follow you both, and also as they do a lot of talks. I think I've been to talks by both of them at completely separate events, so they're always doing talks out there. So I ask all of you, I've seen Paul talk about his PhD research before, and it was really good, and particularly of a controversial topic gives you a lot of it's nice that Paul did a lot of the work for us, and we can sort of steal a lot of his analysis, and I think that's really helpful. So thank you so much for your time this evening, and I wish you the best over the next week, and thank you so much.
Thank you.
Bye.
Bye.
Bye.